Hi, my name is Dr. Eric Miller. I'm a chiropractic physician at Chiro-Med Health Wellness Centers in Orland Park, Illinois. We're going to produce a series of videos this year concerning symptoms that are very readily treated by chiropractic. We're going to be talking about symptoms from headaches to neck pain to upper back pain to lower back pain. The first series is going to address lower back issues and the components that basically cause most lower back pain. Causes such as sacroiliac dysfunction, lumbar disc syndromes, facet joint syndromes are all very easily treated with chiropractic care. The first video is going to address sacroiliac dysfunction. We're going to show you a little bit about our x-rays and what we look for in an x-ray to help us to diagnose sacroiliac dysfunction, and then the best way to treat that. So today's topic is, again, sacroiliac dysfunction. So the sacroiliac joint is the joint that is between the sacrum, which is known as the tailbone, and the iliac bone, which is the pelvic bone. So generally you have two dimples on either side of your waistline, right around the belt line, right at the waistline. Those two dimples are called the sacroiliac joints. The majority of lower back pain ends up coming from the sacroiliac joints. I'm going to show you using an example with x-ray. This particular patient came to us complaining of lower back pain that had been there for probably 2 weeks. Came on gradually. The patient was having difficulty with prolonged sitting, prolonged standing. Getting up from a seated position was especially bad. There was pain directly at the sacroiliac joint, and she really didn't know what to do with it. She ended up finding us, I think she did a Google search or something like that, and ended up finding us for lower back symptoms. She came to us and we did a full examination on her, found out that she does have some dysfunction with her sacroiliac joint, and today I'm going to actually show her her x-rays to demonstrate what's going on with that joint and why the stress is on that joint and what we can do about it. If you look at this particular x-ray, this is a view of the lumbar spine, including the iliac bones, the hips, the sacrum, and the lumbar spine. When I look at this particular x-ray, what I want to see is that the iliac bones are the same height from side to side. Whenever there's a difference of greater than 5 millimeters, that's going to really increase the stress in the area, and that can cause inflammatory reaction at sacroiliac joint. This is the patient's lumbosacral x-ray. The first thing that we do when we evaluate the x-ray is to determine whether the pelvis is properly balanced or not. When we look at this, the left-hand side of the x-ray is right here, delineated by the L. I take a line, I go across from the left side to the right side, and what I want to see is that one iliac bone is the same height as the other iliac bone. In this particular patient's case, we have an 8 millimeter difference, low on the left-hand side compared to the right-hand side. Anything over 5 millimeters is going to cause excessive amounts of stress, and that's going to create basically inflammatory reaction in joints, muscular tension changes, and eventually arthritic changes through the joint because of the abnormal stress. Whenever we have any changes that are over 5 millimeters at iliac bone, we look to the hips. So with her particular x-ray, we see that there is a 4 millimeter difference, low again on the left-hand side versus the right. The difference between the 4 millimeters at the hip and the 8 millimeters at the iliac is +4. This is considered motion through the sacroiliac joint. Anything over +2, again, is a lot of stress through the sacroiliac joint. The center of gravity of the entire body is the S2 tubercle. We expect that the vertebrae are all in line from S2 point all the way up and down, and that's delineated by this black line. Because the pelvis is unbalanced low on the left-hand side, the sacrum has been tipped towards that left side. That eventually basically pushes the L5 vertebrae over to the left, followed by the L4. At L3, the body's recognizing that it's been translated to the left-hand side, and it's basically going to transition and compensate and start pushing the vertebrae back towards midline. That's called the apex of the curve. There's a lot of stress in this particular case at the hip, at the sacroiliac joint, at the L5-S1 facet joint because of the way the vertebrae are basically being pressed together, and then also at the apex of the curve. The goal with this particular patient is to take the pressure off of the sacroiliac joint, to take the pressure off the L5 and the S1 facet joint and to eliminate as much of the inflammation and the muscular spasm that's come about as a result of that protective mechanism. Manipulation is the answer for sacroiliac motion, and basically to move any joint that is not functioning properly due to misalignment, due to fixation, due to muscular spasm in the area that's pulling on the joint. We're going to take you into a treatment room, and I'm going to show you what the sacroiliac joint looks on a patient, and then also deliver a demonstration of what a sacroiliac joint manipulation is. This is my assistant Lauren, and I'm going to show you where the sacroiliac joints are specifically, and then what it looks like to actually have a manipulation of the sacroiliac joints performed. Lauren, let me have you turn and face this way for me. I'm going to lift up your shirt a little bit and show the sacroiliac joints. If you look at the two joints right here, here's the dimple here and the dimple here. These are the sacroiliac joints. And again, probably 85% of the lower back symptoms come from those particular joints. We're going to address the next one, which is disc, in the next video. But I'm going to show you how to deliver a manipulation of those joints to free that joint to help move that joint in space. Let me have you lie on your stomach for me, Lauren.
Thank you so much. You too.
This is called palpation, and what the physician does at this point is basically looking for motion through the segments. Lauren's got a little bit of lack of motion in the left sacroiliac compared to the right. The right side's moving really good, but the left side is a little sticky. You feel the difference there, Lauren?
Yes.
Okay. So what we're going to do is we're going to actually move that. A lot of times when that is present, you'll actually see a difference in leg length as well. She doesn't look too bad there as far as leg length goes today, but I definitely feel that this joint needs to have a little bit more motion through it. Let me have you turn over on your side, left side up. A lot of times when the sacroiliac joint is misaligned, you'll get a reflex increase in tension in the muscles around the joint. So the gluteus medius will get tight, piriformis can get tight, even hamstrings can get tight, as well as the rectus spinae and the lumbar paraspinal muscle area. So releasing the sacroiliac joint in L5 will help to actually allow those muscles to relax. I'm going to put Lauren's leg between mine. I'm going to slide her towards the edge of the table, and then I'm going to put my hand directly on the iliac bone. Then using the force of my body on her hip and pelvis, we're going to gap that joint, and you should hear an audible release. Good. That's what it's all about. Let me have you go flat on your back. The joint released very well, so that should be helpful for the patient and should have an immediate reduction of symptoms. Since she does have some muscular tension going on with that particular area because of that sacroiliac joint, we're going to stretch the glutes as well. This is an awesome stretch for that. I'm going to basically push the knee towards the opposite shoulder so that you feel the stretch come through glute, piriformis some, and some hamstrings. Push up for me and relax. This type of stretching is called PNF stretching. Push up and relax. And push up and relax.
Yeah. Yes.
Good. Okay, come on up. Go ahead and stand and test that for me. How does that feel?
Great.
Good. The next thing that we would do is basically put the patient on physical therapy modalities such as electrical stimulation, intersegmental traction, anything to get the joint moving more like it should and reduce not only the inflammation but the muscular tension as well. So that's it. I mean, it's pretty easy to get the sacroiliac joint moving again. Manipulation works wonderfully. It's just a matter of knowing when you need it and getting the proper care for it.
Bye-bye.
Thank you much.